Assalamu alaikum and welcome to the Dr. UUT lectures. Topic of today's discussion is about migraine or migraine. Well, first of all, we'll talk what is actually migraine. We will define it in short. Then we will talk about the types of the migraine, aura, non-aura, or the migraine without aura, common migraine, or classical migraine. We will tell you about these two types of the migraine. Then we will talk to you about the duration of the migraine with respect to aura and non-aura, or you can say we will talk to you about the duration of the classical migraine and common migraine. Then we will talk about the causes, and after that we will talk about the age factor responsible for the migraine, and then we will talk about the treatment. So these will be the points of our today's discussion. Let's start our discussion from the very first point, that is migraine. What is migraine? Simply, everybody knows this is actually one side over forehead. We have painful sensations in our head, but actually one side of the head is actually in the pain during the migraine or migraine. So we have actually two types of migraine or migraine. The very first one is called as classical migraine. The very second one is called as common migraine. In the classical migraine, we can call this as aura, a migraine with aura. And in this, actually, we have a prodromal phase, a phase in which the patient is supposed to pass through photopsia, tingling, numbness of one side of the body, lips, fingers, face, dysphagia, nausea and vomiting. So all these can happen in this first particular type of the migraine. So what is happening hereby? Let me rephrase all these terms in simple English. So people may feel discomfort in their body, entire body. So sometimes in one side of the body may become numb. You can say that sensations are kind of decreased in the one side of the body, and people may feel strange when they are faced to the light or noise or sound, simple, not noise. So light may be a kind of a very strange type of factor for them. So they will say that we want to go and sleep in a room where there is silence and darkness. So they will feel discomfort with the light. And then after that, we will be having a patient of the classical migraine. That patient will say that I just want have a kind of discomfort in my one side of the body, my lips or my face or my one side hand of the body is actually a kind numb. I cannot feel perfect sensations. So along with that, the patient may be complaining nausea like type feelings, and vomiting may also be observed in that particular type of the patient having the classical migraine. So sometimes the patient may not be able to speak properly. So improper speaking will be seen. Improper speaking style will be seen in those patients, those having classical migraine. Okay. So now, what actually this is actually in these types. First of all, I will emphasize on the aura, the migraine that is having a prodromal phase, or which is called as classical migraine. In the classical migraine, actually these particular point like photopsia, tingling, numbness of the one side of the body, or numbness of the lips, fingers, face, dysphagia, nausea, vomiting. These are actually, first of all, seen in that particular patient. The patient will come with these complaints. So these are actually called as aura, means the feelings that are observed by the patient. And the patient, first of all, undergoes this particular phase. Means the patient will come with a complaint that first of all, I feel numbness for about 5 minutes. Then this numbness actually spreads till lasts till 60 minutes, from 5 to 60 minutes. And just after numbness or dysphagia or photopsia or tingling or nausea or vomiting, if I have such kind of feelings, any 3 2 or any feelings, okay, a patient may feel photopsia, tingling, and numbness of the one side of the body. Another patient may feel photopsia, tingling, numbness of the body, of the fingers, of the face, or nausea and vomiting. And a patient will be there who will be feeling only nausea and vomiting. So now this nausea vomiting will last for about 5 minutes. Will start in 5 minutes. The patient will say that I just have got the feelings of the nausea. So for 5 minutes, he will be having kind of sensations. Then those sensations will aggravate and will start and will last for about 60 minutes. Just after the 60 minutes pass, this duration, after this particular duration, the patient will complain the migraine, the strong type of the pain of the one side of the body will be felt then after these feelings, after these particular feelings. We can say after the prodromal phase. After this phase, then the pain will start. So that's why we put those patients in the category of classical migraine. Got? Very simple point. And we have another category of patients, those that have no aura, no any kind of these feelings, autopsia, tingling, nothing is seen in them. What they say is that they actually feel that their duration, their pain is actually going to start, and that builds up very slowly, gradually, and by the time that pain actually aggravates to an extreme level, okay, that aggravates. After that, this pain lasts for about 4 to 72 hours, okay, 4 to 72 hours. So then they will feel extreme pain of the one side of the head. We can call that migraine. So here we got two types of the patients. One without any kind of feelings before the pain starts, and another with the feelings before the pain starts. So with feelings like this, photopsia, numbing, tingling, and numbness of the one side of the body, and fingers, face, and dysphagia, nausea and vomiting. So if these symptoms are seen, or if these feelings are observed by one patient, so we call that patient as a patient having a migraine, known as classical migraine. So this patient first of all complains this particular phase. A patient goes through any of these points, that photopsia, numbness, nausea, vomiting, any one of these or any two or any three of these may be seen in that patient. So after this particular phase, the patient will switch to migraine. So that will not get first directly the migraine. That patient will first of all go through all these phases, then the pain will start in that patient. Which one? They have the one having classical migraine or the migraine with aura. So then we have another migraine in which there is no aura, no any kind of prodromal phase, no any kind of feelings of nausea and vomiting in the beginning. Just it's actually the pain starts, and this pain actually then aggravates with the time. Gradual increase in the strength of the pain then starts. So then that pain reaches to an extreme level, and then that pain lasts for about 4 to 72 hours. So this is actually about the duration of the pain in the migraine. And with respect to time, or with respect to patient, a patient having first of all the phase, prodromal phase, or the phase with aura, and a patient who does not feel any kind of aura, but just the pain starts gradually, it reaches the peak level, and then lasts for about 4 to 72 hours. That is the difference between these two types, and these two patients, the one without aura, the one with aura, with aura, without aura, classical migraine and common migraine. This was about the duration of the pain, migraine, classical migraine and common migraine. I hope you got. Now, let's come towards the cause. What are the causes of the migraine? So causes change with respect to the patient. Some may get this migraine because of the food, when they see a food or when they eat a food. So they may feel migraine, their migraine may start. And some get the migraine being aggravated or being started by means of alcohol, stress, injury, noise, sleep. Yeah, the point. Sleep. If a person sleeps very less, lack of sleep, or if a person sleeps for so longer periods, in both the patients, what will happen? This particular condition will aggravate or will start or will initiate the pain, the migraine in that particular patient. Whether that is the pain that is a classical migraine patient or a common migraine patient. And contraceptive pills. A female using contraceptive pills may get pain because these pills aggravate or initiates the feeling of the pain, migraine in the female who she has got migraine. So then we have menstruation. Menstruation is also responsible to initiate or start the feelings of the migraine. Now let's come towards the age. What factor is actually age regarding migraine? What age factor people may have migraine? Regarding male, man, boys, it actually starts from the 14. When a person reaches 14, okay, then the migraine may start. Before 14, migraine does not start, okay? So what happens then in the female, the age factor fixed is 18. Around about 18, this migraine attack may happen to the female. Otherwise, before this, there won't be any migraine. That pain will not be called as migraine kind of, okay? So this is actually the main age factor being set for the migraine. These people, if come with a severe type of headache in one side of the head, and with these symptoms, you can place the patient in uh, category of the pain of the migraine, okay? So this is actually age factor. And another interesting point that you guys must remember is that whether it is a male or a female, in them, the pain rises in the early 14 and 18, okay? Then it rises when a patient reaches uh, 40, and then after that crosses the 40. So in the early 40s, 41, 42, 43, like this, in the early 40s, it is actually starts declining. So when it reaches the 50s, so it may and may not, by the way, it may finish. Actually, it rises in the early ages, and when a person reaches the 40s and 50s, it actually declines. Early 50s and late 40s. Late 40s, early 50s, it actually declines. Okay, so this goes this way: rise and decline from 14 or 18 regarding male and female. Okay, male and female. The pain rises when the male or the female reaches 40, 40s or 50s. So in the late 40s and early 50s, then actually the pain declines. This migraine actually declines. So this is about age. Now let's come toward the treatment strategy or the treatment about migraine, of migraine. So if we observe a patient who comes with 2 to 3 times, we can say frequency, if a person comes with a frequency of 2 or 3 in a month, then there should be a preventive therapy being followed to treat the patient with migraine. So that preventive treatment strategy actually contains a number of points. First of all, we will try the medicine on the patient, which medicine is actually showing its effect, and that effective medicine should be taken. After that, physicians and your expert drug pharmacists, so they will then discuss with you that what is supposed to be done from now onwards with you, with your migraine, with your disease, with your condition, whatever you call it. So it is simply informative video for you guys. Well, if you have any question or if you want some more details about this, so you can ask us in the comment box. Simple questions, but this you have to approach us via our email, WhatsApp, and like that. Okay. So that's it all about the migraine. I hope you got. Still, you have any confusions, you can ask us in the comment box. And thank you for watching, Dr. You, another you, Denti lectures. Thank you.